We'll talk about another abbreviation in chemical pathology, and this is the BMD. So, BMD is the bone mineral density. Bone mineral density. So, bone mineral density is just all about you're trying to look at how thick a bone is. Okay, bone mineral density, how thick a bone is. Just straightforward like that. So bone mineral density, you should know that when you're trying to measure how much of calcium and other minerals are present in the bones, of course, the calcium and the other minerals are what make the bone thick. So if they are much, you know that what the bone is strong and it will not fracture anytime soon. If they are low, you know that the bone is weak. So it's linked to issues like those osteoporosis or osteopenia. So the bone can fracture anytime soon. So it measures the mineral content, mainly calcium and phosphorus in bones. So stronger bones will have a higher density. Weaker bones will have a lower density. This is a weak bone, of course. This is a normal, stronger bone. So indicates osteopenia or osteoporosis once the levels are low. Okay. So common tests we have the dual energy X-ray absorptiometry. Okay, usually measures around the hip and the spine. They are the ones that will usually give you a good insight to the general overall of the body. So it's quick, it's painless, there's low radiation, you know, exposure. So they now use this score to now see if somebody is having weak bones or not. So if the levels, let me say if the adult is over 50 most of the times, if the levels are -1 or higher, shows you that there's normal density. If it is between -1 to -2.5, shows you that there's low bone density, but it hasn't gotten to osteoporosis. So it's still at what? Osteopenia. But anything below -2.5, there's what? Osteoporosis. Okay. So we also have the Z score, which basically they compare your bone density to other people that are at your same age. So you can bring somebody of your same age, your same sex, they measure the two of you people and compare. Okay, that's Z score. Okay. So the other one was T score. Okay. So risk factors, what could make it that you are likely to have a low bone mineral density? Your age. It could be that you are losing bone density with your age as you are advancing in age. Your family history. Could be that in your family generally you guys have issues of osteoporosis or fractures. It could be medical conditions like all those chronic disease conditions or endocrine hormone issues. Your hormones are not balanced. Digestive issues, rheumatoid arthritis, you know, and also medications, corticosteroids, proton pump inhibitors, epilepsy drugs. If you smoke, if you take a lot of alcohol, if you are somebody that usually stay in one place, sedentary lifestyle, you know, poor diet. So they diagnose it from, you know, they dictate osteoporosis using it. Okay. And they can also estimate if there's a possibility of you having fractures in any time soon. Okay. And they can also use it to monitor your health. As they are treating you, they are still doing the bone mineral density to see how you are improving, how you are recovering from the condition. So I think that's what we got for the BMD.